Taylor Goldsmith.
Female contraceptives were first introduced to the American drug market in 1960 as a women-driven method of family planning. And on today's market, there's now a large variety of functional and easily accessible methods of contraceptive targeted exclusively at women. Some of the most popular include the oral pill, hormonal and non-hormonal IUDs, the injection, the vaginal ring, the patch, the diaphragm, hormone implants, and tubal ligation. By contrast, there really only are two options for male birth control. Old Faithful over here, and if you get my meaning. While both of these methods do their job, they do have some downfalls. You always have to be carrying condoms, and well, vasectomies are meant to be permanent. Today's contraceptive market lacks a male equivalent to the female birth control pill. Something safe, effective, convenient, and easily reversible. So why the heck aren't there more contraceptive options for men? Well, firstly, let's talk about sex, baby. But actually, once a month, a woman will ovulate one egg, and the female sex hormones, estrogen and progesterone, act as Google Maps for this whole process, telling the egg when to leave its home in the ovary, how to travel down the fallopian tubes, and finally reach its destination in the uterus. Most hormonal female contraceptives essentially stop the egg from leaving its home in the ovary, and they do this by simply telling the egg that it will have to parallel park its car when it reaches its destination. Unfortunately, the thought of parallel parking does not hinder sperm in the slightest. Where women produce one egg per month, men produce 1,500 sperm per second. So in the couple of minutes that I've been up here, each guy in the room has made around 135,000 sperm. And by the end of the day, they'll have made 130 million. And while this process is chiefly governed by only one hormone, testosterone, it's the sheer number of sperm and the frequency of its production that makes this such a hard problem to tackle.
So hard.
So hard. Dick jokes. Despite this challenge, researchers in the field are making some slow steps forward. Current research is aimed at creating reversible infertility, and this type of infertility is defined by a tongue twister of a word called oligozoospermia. Say that 5 times fast, which simply means having less than 1 million sperm per milliliter of ejaculate. To create this oligozoospermia artificially, scientists have a few options. One of the first options is to occlude the vas deferens, or simply put, create a Hoover Dam in the sperm river. Companies like Vaselgel and Contraline are looking to achieve this dam, with the latter company going as far as to call their product the IUD for men. Real fancy. Now, when you dam a river, you have a pretty good chance of creating a flood, as we know in Calgary. And the last thing that anyone wants to think about is a flood of sperm. Ew. Well, fortunately, in this method, the sperm don't actually build up behind the dam. They're just reabsorbed by the body. The companies that I mentioned earlier have had some successful animal trials, and Vaselgel even went into a clinical trial in India. Unfortunately, it didn't work as planned, and in some cases, it didn't even work at all. And it just wasn't as reversible as the manufacturer thought it was going to be, and that's definitely not what men want in a contraceptive option. Other companies have tried to mimic the success of the female birth control pill, using hormones like testosterone in order to stop the baby sperm from growing up into adult sperm. And while these have been generally successful at creating oligozoospermia, they had a variety of different side effects that they caused. Men in the clinical trial reported side effects like weight gain, mood swings, acne, changes in libido, and increased prevalence of depression. And ultimately, the trial was ended due to the severity of these side effects. And as you just heard, this is where I always find the ladies in the room chuckle and roll their eyes, because yes, a lot of women on birth control do experience similar symptoms as these. However, it's important to note that the incidence of these side effects, particularly depression, was significantly higher for the men in this trial than for the average population of women on birth control. And for all the steps forward that we have taken towards mental health, especially men's mental health, it's unethical and unfair to boil the situation down to men just being wimps. So while this contraceptive option scientifically succeeded and was actually 95% effective, it failed in so many other aspects. A lot of people, including the pharmaceutical industry, think that male contraceptives will flop because men just aren't interested. but from what I've seen, that's far from the case. Men want to take part in family planning too. They just want their options to be as safe and as effective as their female counterparts. And while research is continuously moving in the right direction, when it comes to contraceptive options, I wouldn't ditch your condoms just yet.